Let's go.
The March Provincial Coordinators meeting was brightened by the determined CCAC members who walked the picket lines in extreme February temperatures. President Linda Haslam-Stroud praised their tenacity and stressed the impact the strike had on their union, the government, employers, and the public.
They made a statement, and they made a statement not just on behalf of their 3,000 members in CCAC, but they made a statement for 60,000 of us in ONA, saying, you know what? We are not going to take this anymore. Heads up government, heads up employer, heads up public.
Having Heather on my team and my strike team.
Strike leaders came to the podium to share their stories of remarkable solidarity and determination by the members and their supporters.
But some of the things that you find out on the picket line, how strong you really are and how united that your team can be. Everybody on the picket line was saying, you know, this is the best team building we could have asked for.
Because it's together, we're in this together, we did it, and we did it together, so that's it. Thank you. So, that was great, thank you.
Deputy Minister of Health and Long-Term Care, Dr. Bob Bell, joined Nancy Johnson and Linda Haslam-Stroud to praise ONA's leadership around Ebola readiness and workplace violence.
But ONA is one of the best sources of information we've got about how safe your workers are. So I think that's another thing that we've learned, is in partnership we can make worker safety by understanding whether the directives are being implemented.
Toronto East General's former CEO, Rob Devitt, joined ONA's Labour Relations Specialist, Erna Boyna, to review positive, effective approaches to workplace violence in healthcare.
So this is a pictogram that ONA actually put together to demonstrate the extent of workplace violence when you compare us to manufacturing, construction, and mining. And as you can see, we have 639 lost time claims in 2013, and then you've got manufacturing with 77, and construction with 19, and mining with 1.
In a visit to Toronto East General, Rob Devitt showed Linda Haslam-Stroud the strategies he helped employ to make the hospital a much safer place to work.
But I wonder today how many healthcare workers got assaulted. Nobody's filmed it. And more importantly, the media doesn't talk about it. When it's a police officer, it's news. When it's a healthcare worker, it's business as usual. And we need to change that attitude.
A panel of local leaders shared harrowing experiences of workplace violence.
And he got up and he walked out of the room, and I thought I heard a noise, and I went out and he was kicking a frail, nonverbal woman who was sitting in a wheelchair.
And it's been a terrible ordeal, the shock that everyone went through that was on shift that day, and the stories that continue to roll through the department.
Somebody let go, and that the patient managed to give her a lovely uppercut to her nose.
Acting CEO-CAO Marie Kelly emphasized the need for ONA to take a lead role in dealing with violence against nurses.
With us leading the charge on this, that we will get some significant changes, and I also know we have to get those significant changes.
In Belleville, Region 2 held one of several regional health and safety caucus meetings. Members received the new ONA anti-violence toolkits to help them recognize and report violent incidents. ONA is launching an anti-violence in the workplace campaign, which will raise awareness and train members to respond to violence against nurses.
This is what we would like you to achieve in your workplaces. And not only has Toronto East been so gracious, but to attend 5 sessions across the province for ONA.
Quite often, would you agree that we find ourselves in a situation where our attacker may be bigger or stronger than we are?
ONA released a series of social media ads criticizing the Ontario government's decision to cut more registered nurses' hours at Trillium Health Centre, putting patients at greater risk.
A month from now, I'll have an asthma attack, and my mom will rush me to the ER.
In 4 hours, my husband will drop to the ground. He'll spend weeks recovering from heart surgery.
In 2 weeks, I'll break my hip, and I'll need care in a nursing home.
We never know who will need care. We're just dedicated to being there when you need us. But we're worried cuts to registered nurses are making that harder. Wait times are already too long. So why is Ontario cutting registered nurses and putting patients at risk?
I had an asthma attack. My mom rushed me to the ER.
ONA produced a social media video message accompanied by targeted radio ads for the More Nurses campaign. Both were a huge success. A Queen's Park press conference by the Ontario Health Coalition drew attention to the alarming damage to healthcare due to unrelenting cuts.
We are having the gutting of our healthcare services more than we've ever seen in the past. And it's quietly being done one healthcare professional at a time, one service at a time, one small community at a time. Our patients deserve better. Representing the registered nurses and allied health professionals across Ontario, our patients expect us to be their advocates.
A day of mourning was held in Toronto, attended by Mayor John Tory, grieving the loss of Ontario workers in workplace accidents and violence.
To every worker who's been injured or has lost their lives trying to build something.
Nursing Week celebrations were in full swing at many ONA locals across the province, including the open house of Local 111 in Scarborough. Members of Local 80 and Don Mills celebrated Nursing Week at a gala dinner and dance. Everyone joined in to shake off the winter blues.